Vanakkam, good morning. In this video, we are going to discuss about the autonomic nervous system. Autonomic nervous system supplies to the visceral organs like heart, lung, stomach, glands like pancreas, smooth muscles, blood vessels. It is important for the maintain the internal environment of the body. Functions automatically and unconsciously maintain the internal environment of the body. Hypothalamus is the main integrating center of the autonomic nervous system. It has the connections with the prefrontal lobe and the limbic lobe. It has the integration with the reticular formation. Autonomic nervous system has the two components, sympathetic nervous system and parasympathetic nervous system. Sympathetic nervous system activated during the stressful conditions and parasympathetic activity during the rest and calm condition. So the autonomic nervous system balance the sympathetic activity and parasympathetic activity. Parasympathetic system mainly store the energy. It is activated during digestion, defecation, diuresis. During the resting conditions only we can take plenty of food, digestion and defecation, diuresis occur. So rest and calm condition only it activated. Blood pressure, heart rate, respiratory rates are very low. Gastrointestinal tract activity is very high for the purpose of digestion and absorption. Skin is warm, pupils are constricted. Sympathetic nervous system activated during the emergency conditions, exercise, excitement and embarrassment. So it is activated during the E activities. It is important for the fight or flight response. When we are meeting the threatful situation, whether we have to fight with the enemy or escape from the situation, that is mainly depend on the activation of the sympathetic nervous system. During the activation of the sympathetic nervous system, skin is cold and sweating and the pupils dilated, so vision is very clear to see the condition, and reticular activating systems are activated, so person is very alert. Blood flow to the peripheral organ is reduced and vital organ is increased, and blood flow to the muscle is increased, so he can face the stressful threatening conditions, whether he can face or escape from that stressful situation. Difference between sympathetic and parasympathetic. In the sympathetic nervous system, preganglionic neurons are very short, postganglionic neurons are long compared to the preganglionic neurons. The parasympathetic nervous system, preganglionic neurons are long, the postganglionic neuron is very short. Both the sympathetic and parasympathetic, the preganglionic neuron releases the acetylcholine. In the sympathetic nervous system, postganglionic neuron releases the adrenaline, noradrenaline. In the parasympathetic nervous system, postganglionic neuron releases the acetylcholine. The sympathetic nervous system, only few places like piloerector muscles, skin and some blood vessels produces the acetylcholine. Postganglionic sympathetic neuron produce acetylcholine in some places like piloerector muscles, skin and some blood vessels. Functional anatomy of autonomic nervous system. The sympathetic fibers originate from the thoracolumbar region of the spinal cord. short preganglionic, long postganglionic. The ganglia is close to the spinal cord. The parasympathetic nerve fibers originate from the craniosacral region, cranial nerves nuclei and sacral region. Long preganglionic and short postganglionic. The locations of the ganglia close to the visceral effector organs. The sympathetic nervous system originates from the thoracolumbar region, T1 to L2. It originates from the lateral horn of the spinal cord to the white rami communicandis of the spinal cord to the reaches the ganglia, the sympathetic chain. It is close to the spinal cord. So preganglionic neurons are very short. The dashed arrows are the postganglionic fibers. Postganglionic fibers are large. It supplies to the visceral organs and endocrine glands, blood vessels. Parasympathetic division originates from the cranial nerve nuclei and sacral region S2, S4. Cranial nerve 3, 7, 9 and 10. Oculomotor, facial, glossopharyngeal, vagus nerve. It supplies to the eye, salivary, lacrimal glands, parotid salivary glands, heart, lung, visceral organs, large intestine, urinary bladder, ureter and reproductive organs. So in the parasympathetic division, the preganglionic fibers are long compared to the postganglionic neuron. The ganglion is located closest to the target organ. Submandibular ganglion and ciliary ganglion, everything is close to the target organ. Neurotransmitter. All preganglionic neurons in the both sympathetic nervous system and parasympathetic nervous systems are cholinergic, that produce the acetylcholine. The postganglionic neurons of the parasympathetic nervous systems are cholinergic, that produce the acetylcholine. Most postganglionic sympathetic neurons are adrenergic, that produce the adrenaline, noradrenaline. A few are cholinergic, that innervation to the sweat gland, piloerector muscles, some blood vessels are sympathetic postganglionic cholinergic fibers. Functions of the autonomic nervous system. Sympathetic nervous system activated during the emergency situation or stressful condition, exercise. So during and fight or flight response, during the sympathetic nervous system activation, dilate the pupils. We can see the incident clearly and inhibit the secretion of the saliva. So mouth is dry, to accelerate the heartbeat, dilate the bronchi, so respiration is increased very deep. It inhibits the peristaltic movement and secretion in the GI tract. It conversion of the glycogen to glucose. It spends the energy to meet the emergency situation. Secretion of the adrenaline and noradrenaline from the adrenal medulla. It inhibits the bladder and bowel movements during the emergency conditions. Parasympathetic nervous system activated during the calm and resting condition. The pupil constricted and stimulate the secretion of the saliva, slow the heartbeat, constrict the bronchi, stimulate the peristalsis and secretion of the gastrointestinal tract, stimulate the release of the bile for the digestion. It contracts the bladder, so it initiates the bladder and bowel movement. Thank you for watching this video. If you like this video, share your friends. Those who are not subscribed this channel, please subscribe. Thank you once again.